Property taxes in Oskaloosa will likely go up this year. The City Council is considering roughly a 4% increase. 1 week after the Samaritan Inn closed, former residents are settling into new homes. As of Thursday last week, 5 people still considered themselves homeless, but with the help of the Mahaska County Homelessness Coalition, everyone found a new place to stay. Ireland also says if it wasn't for the support of the community, he would be living in his car and spending cold nights in the warmth of Walmart. The Mahaska Health Partnership is bringing its hospital expansion project back to the county supervisors, and it's starting at square one. The Iowa Department of Inspections and Appeals cut jobs of more than 1/4 of nursing home inspectors last month. One Oskaloosa pastor who frequents these homes is worried the cuts might sacrifice quality, but local nursing home administrators say the cuts won't make a negative impact. CRI's Teresa Nguyen has more. All Iowa nursing homes are randomly inspected. Oskaloosa Care Center's most recent inspection was last August. With just more than a month to go before the state championships, the Oskaloosa High School's Jazz Ensemble is peaking at the right time. Last weekend, the Jazz Ensemble picked up the first place trophy in the Class 3A competition at the Indian Hills Jazz Fest. The Oskaloosa School District is changing its student handbook to help protect your child from electronic bullying. It's National Nutrition Month and a good time for all Iowans to remember their fitness goals. 3 months ago, many vowed to get healthy in 2011. New Year's resolutions may be hard to keep, but Mahaska Health Partnership is encouraging residents to stay active in their fight to lose weight. Eat less meat. The United States Department of Agriculture recommends that, and those 3 words could change what you'll find in the Mahaska Health Partnership cafeteria. The cafeteria's supplier, Sodexo, jumped on board the International Meatless Mondays campaign. Iowa meat producers say that decision could hurt business.
Ken Van Gilst and his son Joel have been raising hogs most of their lives.
They're inquisitive.
And together, the local pork producers have survived, battling rising feed costs, keeping customers despite rising retail pork prices, and coping with crop loss after heavy summer rains. Right now, the Van Gilst business breaks even, and the duo is surprisingly optimistic.
We're hanging in there.
But after they heard Sodexo endorses Meatless Mondays, they said it's a poor decision.
Why not a sugarless Saturday or a salt-free Sunday?
I think it's silly. I mean, if we're supposed to have a balanced diet, then it should be a balanced diet every day. There's no sense to single out one day as being meatless because that's not a balanced diet.
The Mahaska Health Partnership cafeteria still offers meat on Mondays.
There you go.
But Sodexo's campaign encourages customers to go meatless at the beginning of the week.
So if we start the week off right, then we can continue through the week, by making healthy choices.
The USDA dietary guidelines released in January suggest the average American needs to decrease his or her meat intake by about 30% to reduce saturated fats.
By cutting it out one day a week, we can reduce our risk for cardiovascular disease, diabetes, obesity, and some cancers.
But the Van Gilsts say not all meat is fatty.
The loin is one of the leanest cuts of meat there is. Yeah, there are plenty of lean cuts in pork that are very healthy.
All in all, the Van Gilsts don't think Meatless Mondays will affect their business, but what they don't understand is why meat is singled out.
They get to eat meat whenever they want, but they don't get a can of pop whenever they want.
If you really want to be healthy, I would think it's more important to get rid of some sugars and some sodium, right?
Sodexo's meatless options echo USDA suggestions to eat other protein-rich foods like beans and nuts in place of some meat. The food giant is expected to launch Meatless Mondays at William Penn and other universities across the country this fall.
Meet Lacey, one of the most popular volunteers at the Mahaska Health Partnership.
She can be a handful, but in the hospital she's different. It's really noticeable.
Lacey is one of 3 therapy dogs that visits the partnership once a week, lending a helping hand or paw by comforting patients and effortlessly painting smiles on their faces.
And she likes to drag me through the doors all the way down the hallway up to the ward because she's really anxious to be, get to visit with everybody.
Way down here.
And for Marjorie McBurney, spending 10 days in the hospital suffering from pneumonia gets lonely. Lacey's visit was the best part.
You want to stay here with me?
But even though Lacey can't talk to the patients, she's very in tune with them and senses what they need most.
Good girl.
Lacey's owner, Vicki, says it's a spiritual connection.
Sometimes she's so overcome she can't move. She just lays there. And I've seen people get healed when it happens. So I know something really special is going on. I don't understand.
But Lacey has also gone through extensive training. She's a graduate of Dog Therapy International, a program that tests and evaluates dogs for therapy work. And as she trots down hospital hallways, she's mindful of Vicky, but spreads joy to staff as well.
Nursing profession is very busy, and when you're walking down the hall with many things on your mind and many tasks, and you meet the dog, you can't help but stop and pet the dog and talk with the dog.
Each week, Lacey meets new patients, lifts spirits, and changes lives.
Always, every time I come, there's something really meaningful that brings me to tears, and I call either my husband or find her or my boss, Kim, and have to tell him. It's every single time.